Bismillahirrahmanirrahim. Rabbi zidni ilma. Quote of the day. The key to success is to keep growing in all areas of life, mental, emotional, spiritual, as well as physical. Assalamu alaikum everyone. My name is Dr. Sadia Rafiq and under the supervision of Professor Dr. Sara Afzal. Today my topic of presentation is epidemiology and public policy. Learning outlines include the introduction to epidemiology, objectives, techniques, application, and its importance. Public health is purpose, cycle, aim, features, type, phases, analysis, evaluation, healthcare policy, recent updates, and multiple choice questions. Learning outcome. At the end of this presentation, participants will be able to describe epidemiology and public policy in detail and its significance. Starting with epidemiology. Epidemiology is the study of distribution and determinants of health-related states or events in a specified population and the application of this study to the control of health problems. Objectives include to identify the etiology or cause of disease, to determine the extent of disease, to study the progression of the disease, to evaluate preventive and therapeutic measures for a disease or condition. They kindly go at the back. That there are three epidemiological techniques which are descriptive, analytical, and experimental. All our three can be used in investigation the occurrence of disease. The method used most is descriptive epidemiology. Major tasks for epidemiology and public health practices. In the mid-90s, 5 major tasks of epidemiology and public health practices were identified. Number 1, public health surveillance, field investigation, analytic studies, evaluation, and policy development. Common practical applications of epidemiology include investigation of infectious diseases. These are done on a routine basis and are conducted by health department to investigate common infectious disease, particularly foodborne illness and foodborne diseases. Importance of epidemiology can't be overstated. Epidemiology saves lives and improves global and long-term health. Its aims are to prevent and reverse negative health outcomes, and the uses of epidemiology are more important for communities that experience a lot of poverty or instability. Disease detective. When disease outbreaks or other threats emerge, epidemiologists are on the scene to investigate, often called disease detectives. Epidemiology and public health. The role of epidemiology is to regularly improving understanding and identifying problems and risks. Public health practices and public policies are about applying what is known and possible. Public policy. A course of action developed, adopted, and pursued by a government, local, regional, national, supranational, and implemented and enforced by its agencies in order to address an issue of public interest. Public policy seeks to achieve certain aims and objectives by setting out a strategy and associated tasks, along with the means of evaluating success. Public policy can be generally defined as a system of laws, regulatory measures, courses of action, and funding priorities concerning a given topic promulgated by governmental entity or its representatives. Purpose of policy. If you see the hierarchy, policies are the distillation of everything above them in the hierarchy. Mission, values, and strategic objectives along with the law. Policies articulate goals that are narrower than strategic objectives, identify limits or boundaries for behavior and action that are necessary to complete these goals. Next, please. Public policy cycle. The process of public policy has a number of stages which interact in a dynamic fashion. It includes the identification, information gathering, decision making, then the implementation, evaluation, and if required, termination, and then renewal. Characteristics of public policy includes it outlines a pattern of solving a particular problem. It is goal-oriented. It is a response by a political system to the challenges and problems arising from the environment. It is usually formulated by government authorities. Types of public policies include regulatory policy, constituent policy, distributive policy, or redistributive policy. Public policy and its features. Its main features include the goal or its goal-oriented, the result of government action, can take various forms, depicts concern of the government. Aim of public policy. The important role of the public policy is to make the society to lead a better life and to maintain the delivery of the goods and services are significant. It is regarded as a mechanism for developing economic social system, a procedure for determining the future, and so on. Advantages. Effective public policy will support democratic institutions and processes, serve justice, encourage empathic and active citizenship, solves problems efficiently and effectively without causing a political rift. Public policies are influenced by a variety of factors, including public opinion, economic conditions, new scientific findings, technological changes, interested groups like NGOs, business lobbying, and political activity. Four types of policies include the public policies, organizational policy, functional policy, and the specific policy. Talking about the phases, the public policy process is simplified form can be understood as a sequence of four phases, which is number one is agenda setting, second formulation, third implementation, and fourth is the evaluation. These are the very important four phases. If we see a policy cycle, there first comes the strategic thinking, then the development of policy, then the implementation of the policy, and in the last, maintaining the policy. Next, please. Policy analysis is the process of identifying potential policy options that could address your problem and then comparing those options to choose the most effective, efficient, and feasible one. Public policy evaluation is one of the most interesting and eye-opening ways to examine the impacts of government policy. Elected officials, policymakers, community leaders, bureaucrats, and the public want to know what policies work and what policies don't. The purpose of evaluation is to determine whether an implemented program is doing what it's supposed to. The term may apply to government, public sector organization and groups, as well as individuals. Presidential executive orders, corporate privacy policy, and parliamentary rules of orders are all examples of policy. Policy differ from rules or laws. Talking about health-related policies, which include policies prohibiting tobacco and alcohol use at the workplace, policies requiring healthy foods to be served at company meetings and events, policies allowing for flex time to exercise or attending health programs. Examples of healthcare policies, the patient care policies, drug policies, security and privacy policies, employee health policies. Good public policy seeks to define issue and implement strategies that will produce a measurable and positive result for the general public. Health in all policies. Many areas of public policy can impact health, and health can impact many different policy goals. Next, please. Healthcare policies. On the federal level, elected and appointed officials write healthcare policy with input from other professionals. Like other public policy decisions, healthcare policy on the federal level is traditionally made through the three branches of the government. The judicial branch interprets the policy. Major issues shaping our healthcare system, basically the access to healthcare coverage, social barriers affecting population health, and the healthcare cost and spending. Public health policy is crucial because it brings the theory and research of public health into the practical world. Public health policies create action from research and find widespread solution to previously identified problems. Health policy. Public health promotes the welfare of the entire population, ensures its security and protects it from the spread of infectious disease and environmental hazards, and helps to ensure access to safe and quality care to benefit the population. Public health policy is defined as the laws, regulations, actions, and decisions implemented within society in order to promote wellness and ensure that specific health goals are met. Public health policies can range from formal legislation to community outreach efforts. Healthcare policy is important because it helps establish guidelines that benefits patients, healthcare organization, and our healthcare system. Having protocols in place can help prevent human error and poor communication around medical decisions. The overall objective for public health policy is to create a conditions for good and equitable health among the entire population and to end avoidable health inequalities within a generation. Analysis is important for public health policies for several reasons. This phase gives public health professionals and other stakeholders the opportunity to more deeply research and strategize around the potential solutions to the issues. Policies, public policies at the local level, such as tax structure, budgeting, and employment regulation, directly affect the economic prosperity of the community. Effective cooperation among government and private sector leads can generate economic development that moves community forward. 5 ways public policies impact health. Number one is creation and regulations of public good, regulation of natural resources, requirements and mandates to protect citizens, direct support, and the creation of opportunities and incentives. Primary objective of public health and epidemiology is to preventing epidemics and spread of diseases, preventing injuries, promoting and encouraging healthy behavior, protecting against environmental hazards. Top 10 research used for effective public health policies. Health services research can influence policy making in 4 ways. Number one, they can identify critical problems, research the benefit and harms of policy solution, estimate the cost and consequences of policy proposal, and actively participate in the policy process to aid real-time decision making. Top 10 public health challenges nowadays are alcohol-related harms, food safety, healthcare-associated infections, heart disease and stroke, HIV, motor vehicle injuries, nutrition, physical activity and obesity, and prescription drug overdose. Policy issue regarding risk. Public policy is developed through the processes of legislation and regulation. Litigation has become an important instrument for developing and implementing public policy. Certain major societal issues must be considered in making decisions about risk and the following. What percentage of the population should be protected by the policy? What level of risk is society willing to tolerate? What level of control of risk is society willing to pay for? And who should make decisions about risk? Policy making requires a balance between what can be done and what should be done. Moving towards the recent updates. It is one of the articles in CTZ, it is the legal epidemiology. Basically, legal epidemiology is the study of law as a factor in the cause, distribution, and prevention of disease and injury. It applies rigorous scientific methods to translate complex legal language into data that can be used to evaluate how laws can affect population health. Next, please. So, chronic and non-communicable health conditions continue to drive morbidity and mortality in communities across the United States, posing a significant threat to nation physical and economic health. So, if these laws help a lot to understand regarding the patient as well as what the facilities are available to them. Next, please. Epidemiology and Policy Solution. It is by CDC, the National Institute of Occupational Safety and Health. Basically, occupational aviation, in this, the policy analysis and intervention was done. It was a multifaceted approach, and the number of, during this, it was observed, but the change in the policy of the aviation, the number of fatal crashes during air travel and operations in Alaska decreased 53% between 2000 to 2009. It was just by the basic change in the policy of the aviation which impacted so much. So the policy regarding any specific occupation plays a very important role. Next, please. It was an article between balancing science and public policy in Pakistan's COVID-19 response. Next, please. In this background, they were seeing we evaluated available in this available national, sub-national epidemiological data was used, and the conclusion was that despite notable success in controlling the pandemic, several weaknesses remain and there are a risk of rebound in the economy of educational systems response. It is continued need for strong technical and programmatic oversight linked to civil society engagement and working with religious scholars to ensure non-pharmacological intervention compliance to control in the COVID-19. It was study done by Naga Khan, and it was decided to make some sort of policies including the community participation should be there, and then the policy should be made to prolong all these treatments and preventions of COVID-19. Next, please. It is health policy and planning dynamic of evidence informed health policy making in Pakistan. Next, please. Incorporate evidence is fundamental to maintaining the general acceptance and efficacy in public policies. In Pakistan, different actors, local and global, strive to facilitate the development of evidence-based health policies. Effective involvement, however, requires knowledge of the country. So the study highlights the non-systematic, nearly ad hoc way of adopting health policy in the country, overly dominated by political actors. Health advocates need to understand the policy process and actors involved if they are identify points of impact where the interaction with policy brings the maximum leverage. Moreover, an environment is needed where generation of data gains the importance it deserves and where capacities are enhanced for communicating and understanding evidence as well as incorporation into policy. Next, please. It is at article landscape analysis to provide height of barriers and facilitators to policy translation and community access in the public private sectors for child survival in Pakistan. Next, please. This was basically a landscape analysis on pneumonia and diarrhea among children of Pakistan who have been regarding as disease of poverty closely living in conditions with very poor hygiene and sanitation. UNICEF and Bill Gates, Melinda Gates established a partnership to contribute to increase child survival in Pakistan. And this study was done to provide insight on barriers and facilitators to policy translation and commodity areas in public and private sector. Next, please. It was a cross-sectional study and it was done in Punjab and Sindh. In Sindh, Tharparkar and Sheikhupura and Tandu Muhammad Khan, and in Punjab, Pakpatan and Bhavanagar, it was done. The research findings have been arranged in policy environment, clinical management, pharmaceutical feasibility, and accountability framework. Next, please. Based on these findings and recommendations, joint accountability framework was prepared and identified the intervention with the allocation of responsibility. And the following identified outcomes were the putting in place updated policies and strategies, incorporation of global recommendation in clinical management practices, local production of proposed commodities, strengthening of supply chain and logistic management of new commodities, and budgeting for a new updated commodities. Next, please. These are my references. Next, please. Now it's time for MCQs. Organizations that pursue the common interest of group of people by attempting to influence the making and implementation of government policy are known as political parties, interest groups, lobbyists, social movements, policy communities.
E.
No, the correct answer is B, interest group, because it is the organization that pursue the common interest of group of people. So the answer is B, interest group. Next, please. In order to be effective in influencing government policy, interest group requires money and expertise, a large number of members, a permanent headquarters, lawyers, or access to media outlets.
A.
Yes, the correct answer is A, because interest group without money and expertise, you can't influence it. Next, please. Which of the following is not the core values of public administration? Equity, efficiency, effectiveness, or bureaucracy?
D.
Yes, D is the correct answer. Bureaucracy is not the core value of public administration. Next, please. A network of groups and individuals that seek major social and political change, who act outside of established political institution, is commonly referred to as old social movement, policy community, social movement, public interest group, new social movement.
C.
Yes, C is the correct answer. C, social movement. It is a network group of individuals that see. Yes. Next one is, during which part of public policy cycle does the government explore potential policy response? During agenda setting, policy formulation, policy implementation, or decision making? The correct answer is B, policy formulation. It is the time when the government explores potential policy response. Next, please. When a relevant minister holds a news conference to announce the government's intent to introduce a new policy, what is it known as? Decision making, policy evaluation, policy implementation, or policy change?
D.
C is the correct. Whenever the minister government representative holds a conference, it means the policy is being implemented. So C is the correct answer. Next, please. The National Environmental Policy Act required all federal agencies to conduct a prior taking any major action. Means testing, cost benefit analysis, environmental impact statement, or tax assessment.
C. B.
No, C is the correct answer as it is a National Environmental Policy Act. So it will be requiring an environmental impact statement. Policy administration is the study of maintenance of law and order, control of trade and commerce, public policy implementation, or political administrative dynamics of the state.
D. D.
Uh, C is the correct answer. Public administration is the study of public policy implementation. So it's related to administration process. Formal relationship in an organization is based on rules and regulations, authority or on subordinates, peer groups, friendships.
A.
Yes, A is the correct answer. Rules and regulations are the formal relationship in any organization. The study of government decision making, the analysis of the policies themselves, the various inputs that have produced them, and the input necessary to produce alternative policies is called public administration, administration of authority, properly administration, or administrative capacity.
A.
A.
Yes, yes, A is the correct answer. And next is my key, and thank you so much.
Thank you very much, Dr. Sadia. Wonderful presentation, very informative, and especially I'm really amazed by the how you have managed to present today against all odds. And you are one of my students who never cease to surprise me with your motivation and drive that you have for learning and sharing knowledge. And once again, against all the odds, because we know that there was a load shedding and there are so many things that are beyond our control, but still we are sharing knowledge, and you have presented beautifully. So I must applaud your spirit and your commitment to learning and sharing knowledge, and
Thank you.
how beautifully you have presented. It has really amazed all the learners, and we have learned so much from you every time, not only as a scholar but also as a good human being, a dedicated person, and a committed professional. Very well
Thank you.
done, Dr. Sadia, and I
Thank you so
hope
much.
this learning would continue from each other and keep shining and keep inspiring us. Thank
Thank
you.
you so
Allah
much.
Hafiz.
Allah Hafiz.
Allah
Thank you
Hafiz.
so much, Dr. Number. Thank you so
Allah
much.
Hafiz, ma'am. You're welcome, Dr. Sadia. Allah Hafiz.